Welcome back. New research is linking loneliness to an increased risk of dementia, anxiety, heart disease, stroke, even early death. Now states are trying to take action. San Mateo County in California is the first county in the U.S. to declare loneliness a public health emergency. Leaders there are promising to promote social connection in the community.
Here to talk a little bit more about loneliness and this new resolution is our 9 News parenting expert and therapist, Dr. Sheryl Ziegler. Dr. Ziegler, good morning to you.
Good morning.
So the first question I want to ask you, if this is just an issue in that area or region, or is this something we're seeing more widespread?
Widespread. So this is something that the Surgeon General declared a public health emergency last year. And we're seeing this in every kind of city, rural community, doesn't matter, probably actually is really worldwide. And so depending on sort of the sample that you take, the loneliness epidemic is, people are reporting in San Mateo County, I think up to 47% of people talking about being lonely, disconnected, not having a lot of visitors. People that work on Meals on Wheels will say sometimes the elderly, which this isn't really just about the elderly, but they might be the only person they see the whole week. But we've also got teens and young adults who the only way that they interact with people is on screens. So this really also affects not only the whole country, but all sorts of age ranges too.
Does it affect certain populations more than others?
So like so many other things, it disproportionately affects Black and brown communities because they live maybe in poorer areas, right? So if you're disadvantaged, maybe is the better way to say it, then you might not have community parks. You might not even have sidewalks if you pay attention to infrastructure. So what I think is really interesting about this shining a light is, yes, it's a mental health issue, but this is more than that. It's really a systemic issue. Do you have communities in which there are places to gather? That's very important.
And I know Anusha Roy was talking to us yesterday about rural communities specifically too. Farmers are, dying by suicide at twice the national average because of that isolation that they're dealing with as well. What are some ideas that can help out, especially if you are in an area that you're not really surrounded by a community or places that you can go to be that?
So one of the things is really thinking about libraries. So in your community, if you've got libraries, community centers, Lions clubs, you have parks, rec centers, coffee shops even. We see that a lot, of course, in the cities where lots of people are at coffee shops and they're working, just being around that. So if you're feeling lonely, and maybe right now in this exact moment, you think, I don't even have somebody to literally reach out to, physically being around other people, particularly when you're not on a screen or device, allows for the opportunity. Maybe we catch eyes.
So being alone, but you're technically, let's say, when I was dealing with my anxiety really badly, my mom said, take yourself out to eat lunch.
Yes.
Even if you're sitting alone, you're like around other people.
Yes.
Go for a walk in the park.
Yes, because you feel their energy. You might have some, light talk with the waiter or the waitress, but you also might catch somebody's eye, or they might have a child with them or a pet with them, and go up to them, oh, I love your dog, or, oh, look, just small talk really does something to us. It lifts our oxytocin, which is our love hormone. It also kind of gets some endorphins going in us. And it reminds us that we're not alone. Because that's always a theme of this is like, if you're feeling lonely, you're not alone. But of course, you feel alone while you're going through it.
And that's kind of the part of this. I know that San Mateo is the first county. They, like the UK and Japan, have done similar things. But they're not saying we're pouring money into this. They're just essentially saying, we get how you're feeling and other people feel the same way, right?
Yes, and that was a part that it was like a little disappointing to see because they're shining the light, but they don't have the funds, at least for this year, that they have allocated for this. So that means this kind of has to be grassroots. And so first step is this, we're talking about it. Even here, we're not immune to this at all here in Colorado. Talking about it is the first step. And then these simple free things that you can do. Because here, at least in Denver and a lot of the suburban communities, there are parks and rec centers. And I can't say enough about our library systems. Really check out the programs that they have there. They're not just for kids. They're for adults and they're for older adults. So there are ideas, but you kind of have to have like that energy to put a little bit of effort into it. But again, just physically being around people is a great start.
Yeah, well, I hope maybe somebody at home who's struggling with this very thing is, hearing something that really resonates with them and we can get them the help that they need. By the way, we do have resources also on 9news.com for anybody who may be struggling. Dr. Ziegler, thanks for your time.